Hello everyone. Good morning. So today is the sixth day of our class. 5 दिन निकल गए. Huh? And we got to know so many variations in last 5 days. Yeah. And we hope that it is becoming beneficial for all of you. So today is a topic where we will try to boost our stamina and step up to our pace. Yeah, तो आज हम थोड़ा और आ, हमारे जो एक्सपर्ट है वो जो सर कुछ बताएंगे जिससे हम कैसे हम अपने स्टैमिना को बढ़ाए उसके लिए हेल्प होगा. या गुड. या सो इफ यू कांट हियर यू कैन जस्ट शिफ्ट टू द यूट्यूब. अगर आप सुन नहीं पा रहे हैं तो फिर आप यूट्यूब पे शिफ्ट हो सकते हैं. यस. So how you are feeling today morning? Can you just describe in one word how you are feeling today morning? Till that, let me welcome Ojas sir on the stage. Can you describe in one word how you are feeling? Fresh, happy, fine, good, energetic, rejuvenated. Oh, great, good and healthy. Wonderful, amazing, amazing. So welcome Ojas sir. Welcome on the stage.
Thank you.
Thank you.
Namaste, everyone.
Namaste.
I hope all of you are fine. So let's begin with today's exercises. So I'll give a brief first. Yesterday we did on the spot marching and we did straight leg raising, SLR, and today will be a progression of those exercises. So I will repeat the SLR and I will introduce a variation in the marching. Yesterday we did marching on the spot, 30 seconds in one go. Today we will be doing 10-second slots thrice with breaks in between so that people who are fatiguing earlier, they can do this way. So I will demonstrate that today, and we will be introducing one or two new exercises which will help in some particular angles of knee in strengthening the muscles. So let's go. So before we proceed, you will need a towel roll or a pillow, which will be needed for a particular exercise, which I'll tell you later on. So we will begin with marching. So acquire your spot, be comfortable, put your hands on the sides. Your elbows can be bent like this, or it can be straightened like this, according to your body allowance. So yesterday we did with elbow bent. I am having comfort with elbow bent, so I'll be doing this way. You can either do this way with straightened elbows or this way. So I will demonstrate to you in a side view position so that it is more visible. So let's proceed. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Now you can take a break and stand comfortably. Loosen up your arms. You can straighten up your elbows if they were bent during marching. So this is our natural standing position, which we call technically as an anatomical position. You can rest your arms this way. Now we will repeat the exercise once more. Attain the position, be comfortable, make your fists and start doing. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Again, take a rest. So you must have noticed that while I was doing the marching part, my back and spine were leaned slightly forwards. So this can be done and this should be done while we are doing marching your back or spine should lean slightly forward, not very much, but slightly, because that's how the muscle will be triggered. So we can do it again for 10 counts. Attain the position, make your fists. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So this way you will not fatigue earlier and you will be able to do it in a sustainable manner. You can do it for 15 seconds in one go. You can do it for 30 seconds in one go. This is as per your body allowance, as per your fatigue level. Yesterday we did 30 seconds in one go. Today we are doing it 10 seconds in one go with breaks in between, and we did it thrice. So we are done with the warm-up exercise. Again, telling you that this is a good warm-up, and this should introduce some amount of sweating in your body, which is normal and it is healthy also. This will improve the neuromuscular coordination of the body, which means that your body balance will increase and the muscle strength also will increase at the knee level. Now, moving on to the other exercise, you need an exercise mat for that. You should attain a lying position, and we'll be doing the SLR exercise, that is straight leg raising. So be comfortable, lie down. First, you can attain a long sitting position and then lie down. So I could see in a lot of queries that there were some queries about bridging exercise. So I will repeat that exercise also. For bridging, we keep the knee position as bent and lie down comfortably on your back. Use your palms to face downwards. Put pressure downwards and lift the back up. This is what we did in bridging. We have to hold this position. Your spine should ideally be neutral, but it can be slightly bent down like this. The idea is to hold it. So while holding the spine, your muscular effort is being done. So with a proper muscular effort, you will be triggering the muscles here in the spine as well as around the knee. So this was about bridging. Now moving forward to SLR, attain a lying position, legs relaxed. So as I told you yesterday, if we have to do it for left leg, then you have to bend your right knee. So bend your right knee, lift your ankle up towards yourself on the left side and lift the leg up. Hold this position for about 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So if it pains while lifting it up or while you're holding, maybe you can tilt your leg slightly outwards and this way it will not pain. So moving on to the other leg, I will bend my left knee, straighten my right knee and lift my right leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Relax, go into a full lying position. You can take a break of few seconds and then move forward with the other leg. Now I am lifting my left leg. Hold this position. Your foot should be slightly bent towards yourself. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. You will see that with time, with more practice, you will be able to lift it up more. If you are not able to lift to much extent, even if you can lift to this extent, that's okay. That's absolutely fine. It is natural to lift it to a lesser extent when you start. The idea is to develop muscle control. You should not force to lift it to more extent, but the idea is to develop more control over the position. So if you can hold it this way better, then you should limit to this extent only. Now we will lift this leg up. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Going to the left side. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Again, right side. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. While doing this exercise or any other exercise, it is very important to have a visual feedback to the brain. So if you see the area which you are targeting, this gives a visual feedback. So let's say I'm lifting my left leg and I'm holding it. I'm counting verbally, I'm giving a verbal feedback. I'm seeing the leg, I'm seeing the foot, I'm giving a visual feedback, and I'm directing my mind towards the exercise. So that's very important. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So we are done with the SLR exercise or straight leg raising. Now we will move to another exercise which we call as side leg raising. So for this, you have to attain a side lying position. So this is a side lying position. You can rest your head here like this. You can use a thick pillow. Your neck should ideally not bend down and your leg should be straightened, knee should be straightened like this. So this is a progression of clamshell exercise which we did yesterday. To repeat what we did in clamshell, so in that exercise, the knees were bent and we lifted it up like this, holded this position for a period of 10 seconds. Now in that the knees were bent, so it was easier for us to lift it up. Now we are challenging the knees, we are straightening the legs. So while straightening the legs, we are increasing the challenge or resistance to the knee. So this will demand more effort from the knee muscles. So they will strengthen more over time. Now we will lift the leg up with knees straightened. So this is side leg raising. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. You can take a rest. Take a rest of around 10 seconds and then we will repeat it again. You have to do it again both the sides. This is my left side which I am lifting right now. I will repeat for my right side also. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Take a rest for a few seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So let's change the side. Take a sitting position like this and then shift to the other side. Lift the leg up. Hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Take rest. Now you can take your other arm and use it for additional rest while doing the exercise or while resting in this position. Your pillow again should be this much thick that the neck does not bend down. Lifting the leg up again. Hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So while you're doing this exercise, your effort should come from this area. You will feel some muscular effort in this area, which means you are doing the exercise correctly. If it is not coming from this area, if you are feeling some pain above the knee this way, then you can slightly move the leg outwards. Then the effort will start coming from the hip area. Rest the leg again. Take a rest for a few seconds and we will repeat it again. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So we are done with the side leg raising exercise. Now you can have a seated position. As you can see, I did not attain a sitting position directly. I first went into a side lying position and then I sat up. So similarly, you have to do whenever you sit up from a lying position, first आपको करवट के बल लेटना है, उसके बाद आपको बैठना है. ये आपके स्पाइन हेल्थ के लिए बहुत ज़रूरी है, especially for patients with back pain, low back pain. You have to lift up always like this. Now we will move to the other exercise, which we call as a short quadriceps arc. So for that, you have to use your pillow or towel roll. This should be slightly more thick. So what we will do is we will place this beneath our knees. So if you remember, in initial days, we did quadriceps isometric exercise, in which we again used this pillow or towel roll and we pressed it down. But in this exercise, that is short arc exercise, you have to lift your leg up. You don't have to hold, you have to lift your leg up from a bent position. So if you use a thick pillow or a thick towel roll, your knee slightly bend down if you see it correctly. So you have to lift your leg up. You will see that my foot is slightly elevated from the ground level. You hold it in this position. You are not pressing it downwards. You are just lifting it up and bringing it down. For additional effort, you can hold it up for a few seconds, or else you can repeat this lifting activity again and again. So I am demonstrating the lifting activity. 1, 2, 3. What we are trying to do is we are trying to target some particular muscles over the knee. We call it as vastus medialis obliques, VMO. So this is VMO strengthening. VMO muscle is very important for strengthening of the knee, protection of the knee. It is particularly active during the terminal ranges of knee joint motion. So that is why we are just triggering the last range of knee joint. So we are lifting the leg up in the end range. You can take a rest and shift the leg to the other side. So you can hold your other leg and I'm placing the towel roll on my left side. Again, lift it up. 1, 2, 3, 4, 5. You can support your spine using both of your hands by placing them on your waist area or else on the ground level like this. It will help you in keeping the spine straight. A straight spine helps in increased strength at the knee level or any other peripheral joint. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So for a good start, I have kept the number of repetition to 10 counts. Any exercise can be started with this count number. It is very easy to attain. Shifting to the right side again, place the pillow or towel roll and lift the leg up. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. You can keep your feet relaxed or perpendicular to the ground level while doing this exercise. It is either way is okay. You should notice your body signal in whichever position it is more comfortable, it is not paining, not straining. That position you can take. And while doing the exercise, if it pains a little bit here around the knee area, inner side of the knee, that is fine because we are targeting that particular muscle. So it will develop some amount of fatigue. Now shifting again to the left side. Place the pillow or towel roll beneath the knee and lift the leg up. One, two, three, four, five, six, seven, eight, nine, and 10. Shifting again to the right side. One, two, three, four, five, six, seven, eight, nine, and 10. So that's it for today. We are done with today's exercises. We did marching, on the spot marching, then we did straight leg raising. In straight leg raising, we holded the position for up to 10 seconds. You can increase the holding time to 15 seconds. Since it is our second day, you can progress through that holding time. Or else, if you feel that your body is not allowing it, you can continue with the 10-second hold. And then slowly and steadily, you can just move on to 15-second holds. Then we did straight leg raising in a side lying position and lifted the leg up, folded it up for a period of 10 seconds. And we ended with the short arc quads exercise, in which we placed a pillow underneath our knees and lifted in a short arc form. So that's it for today. If there are any queries, I am open to queries.
Yeah. So thank you so much. There are a few questions which I'm taking from a query form. Can we wear knee socks for knee pain?
Yes, you can wear it, but it will provide some relief, it will provide some warmness, it will add to the lubrication part also, but it will not directly help you with the root cause of the knee pain. So it is good as an assistance, but you have to get a proper assessment done for the right cause of the knee pain.
Can we apply oil for the knee massage, and if yes, then which?
You can apply oils, and the right way of applying is using a light pressure, very light pressure. You should not apply a deep massage. You should apply the oil with a very light pressure. There are different varieties. You can use oils, you can use ointments, there are gels, there are roll-ons available. In a roll-on formulation, you need not massage the area, just apply the roll-on if it is available with you.
Yeah. Many of our users are asking that which sequence we should follow after this 7 day challenge for everyday, knee relaxation, or what should we choose from the complete range of exercises what we did.
I'll give you a brief. Since it is a 7 days challenge, so we had to compile all the exercises in one go to the 7 day period. But for you to have it a daily practice, you can have a different sequence. The rough sequence will be in a similar way in which we did the 7 days progression. So maybe what you can do is divide the 7 day exercises weekly. So let's say what we did in day one or day two, we do that for 1 or 2 weeks. Then you can shift to day three exercises in the third week. In a similar way, you can proceed further.
Okay, so you mean to say that how we have break down the things, exercises on daily basis, so in that way they can also do a rotation of that exercises
Right, right,
in the week time.
right.
Yeah, I have blood pressure issue. So you said that I should do it for only 3 to 5 counts, or holding duration is less. Why is it so?
So the reason being, whenever you hold it for a more period, let's say 10 counts, so while holding, the BP shoots up. That's a normal physiological reaction of the body. So for people with uncontrolled hypertension or very severe rise in BP, it can shoot up the BP. That is why it is recommended to keep the count low.
Yeah, हिंदी में भी बताया बोल रहे हैं.
जी ज़रूर। तो अगर आप आइसोमेट्रिक एक्सरसाइज कर रहे हैं या किसी भी एक्सरसाइज में अगर आपको होल्ड करना पड़ रहा है 10 सेकेंड्स तक या कितने भी पीरियड तक, तो होल्डिंग पीरियड में हमेशा बीपी शूट होता है। तो इसीलिए जिनको बीपी की दिक्कत है उनके लिए ये रिकमेंडेड है कि वो होल्डिंग पीरियड कम से कम रखें। सो वो 3 से 4 सेकेंड का सफिशिएंट रहता है, जिसमें थोड़ी बहुत होल्डिंग कैपेसिटी भी आ जाती है, थोड़ी स्ट्रेंथ भी आ जाती है, एंड बीपी शूट अप होने से भी हम बच जाते हैं।
Yeah. Will this exercise will help for correcting the flat feet also?
Not directly, but yes, indirectly they will help for appropriate correction of flat feet. First of all, it needs to be decided that is it a structural flat feet or is it a muscular flat feet. मस्कुलर फ्लैट फीट ये होता है कि स्ट्रक्चर परमानेंटली चेंज नहीं हुआ है, बोनी स्ट्रक्चर चेंज नहीं हुआ है, आपकी मसल लेवल पे वीकनेस है, तो उसे हम एक्सरसाइजेस के थ्रू ट्रीट कर सकते हैं। लेकिन अगर बोनी स्ट्रक्चर जो बोन्स एंड जॉइंट्स हैं फुट के, उनमें परमानेंट चेंजेस आ गए हैं, तो उसको चेंज नहीं किया जा सकता। ये जानना बहुत ज़रूरी है कि आपका कौन सा है। तो उसके लिए आपको प्रॉपर असेसमेंट करवाना चाहिए पोडियाट्रिस्ट से या ऑर्थोपेडिक स्पेशलिस्ट से।
Yeah, thank you. Can we do the last exercises with both the legs together?
नो, यू शुड डू इट वन लेग एट अ टाइम। You can either do it alternate legs, or you can do it
Short
one leg at
arc
a time for
quads.
10. Sorry?
The exercise was short arc quads, right?
Yes. Short arc quads, you can do one leg at a time. Either you can do the 10 repetitions of exercise one leg at a time, or you can do it alternative legs. So we did in an alternative manner, but the number of repetitions will be 10 for each leg. But you should not do it both the legs at one time, because the effect of exercise will come down.
Yeah. And is it necessary to maintain the order for doing these exercises? So how we start with the warm up? So is it necessary to go in that sequence only?
Yes, it's absolutely important, because first we warm up. In warm up exercises, we are basically trying to increase the metabolic rate of the body. We are trying to develop some amount of warmness around the knees. So when there is warmness, there is more elasticity in the muscle fibers, in the soft tissue fibers, apart from the muscles. So what they do is, if they are warmed up, if they are more elastic, then the chances of developing strength and flexibility are much more.
Okay.
Also you prevent a lot of injuries. If you do directly the exercises without warm-ups, you can invite a lot of injuries around the knee. And if once you develop an injury, it takes at least few days to, few days of rest.
Okay, great. Um, there are, questions around the general guideline. Can we do cycling? Will it strengthen the knees?
Yes,
Uh,
definitely you can do strengthening, cycling for strengthening the knee muscles. It will help with the flexibility part also, and the coordination part also. But it is important to note that you can do static cycling if you are having a particular knee condition, a diagnosed condition. If you are doing it generally just for preventive health, you can do normal cycling. But if you are a patient of any knee condition, you should do static cycling.
तो घर पे ही जो साइकिल रहती है हमारी उससे ही आप कर सकते हैं।
हाँ जी।
अ, बाहर जाएंगे तो वो थोड़ा सा तकलीफ दे सकता है आपका जो हम नॉर्मल साइकिल यूज करते हैं, तो आप ऐसे करें।
जी,
Then can we do Surya Namaskar with knee issues?
you can do Surya Namaskar with knee issues, but you need to modify certain knee positions. If there is too much pain, you can avoid much bending of the knee. You can bend the knee to the extent it is pain free. And so with modifications, you can do Surya Namaskar.
हम्म, ओके। घुटने में पानी हो तो कौन से एक्सरसाइजेस चूज करना चाहिए फ्रॉम द लिस्ट?
अगर घुटने में पानी है और वो बहुत ज़्यादा है तो पहले आपको ऑर्थोपेडिक सर्जन को दिखाना चाहिए एंड उसका ट्रीटमेंट कराना चाहिए. देन यू कैन मूव ऑन टू एक्सरसाइजेज आफ्टर द इशू इज रिजॉल्व.
Okay, great. Mm. Do we get all the PDFs? Yes, you will get all the exercise PDF and the recording. Once we complete the session, you will get all these things. To worry. And also, we are sending the everyday recording, which can you just do replay and do this exercise for yourself. Yeah. Yeah, so someone is asking, my walking is like a duck. So which exercise I should do?
So, so today we did side leg raising, and yesterday we did clamshell exercises. Those exercises you can do for duck walk, or else you can also add one other exercise, that is leg raising in a prone lying position. By prone lying, I mean lying on your stomach. आपको उल्टा लेटना होगा एंड देन अपनी लेग को रेज करना होगा, वन लेग एट अ टाइम, एंड उसे होल्ड करना होगा फॉर अ पीरियड ऑफ 5 to 10 seconds एज पर योर कंफर्ट. सो प्रोन लेग रेजिंग, उल्टा लेट करके लेग रेज करना. साइड लेग रेजिंग, करवट के बल लेट करके लेग रेज करना. एंड क्लैम शेल एक्सरसाइज, जिसमें करवट के बल लेट के घुटने मोड़ के लेग रेज करने हैं.
Okay. Someone is asking that should I'm doing 5,000 steps every day. Is it okay for me? I'm also having a knee issue.
So it is very important to note your body signals. If 5,000 steps is very comfortable, you don't feel any uncomfortable sensation, fatigue, pain in the knee, you can do that. But if you feel pain before 5,000 steps, then you need to modify it. You need to decrease the number of steps, and maybe taking frequent breaks in between, and then again repeating the number of steps. So this way you can proceed.
Which is good for walking, treadmill or going out for walking?
Going out for walking is always good, always better than treadmill, because in treadmill the base is not stable, it is moving. So for people with knee conditions, it is better to have a stable ground. So a normal walk is better.
Okay, so last question of the day. How I can get rid of the heel pain? We're
So
talking about knee pain, but heel pain, yeah.
heel pain, the causes can be many. So it is difficult to define the cause with this much of information. You need to find out the right cause. If you are wearing any heels, high heels, you should avoid that. You should use flat footwear or very minimal heels you can use. You can use certain stretching exercises. Let's say you can have a seated position and place your painful heel like this, and you need to stretch it like this and hold the stretch for a period of a few seconds. It should be around 20 to 30 seconds, and release that. You can repeat this exercise as per your body's allowance. And yes, definitely you need to go for a right checkup, right assessment to find out the right cause.
Yeah. So it is important to, find the right cause for your problem. Most of the time, we just generalize the thing. For example, for the knee pain also, we generalize the thing and we start following certain exercises from WhatsApp University or yeah, from the YouTube videos. But it's nice to have a diagnosis of what exactly the problem is, and based on that, what is the comfortable exercise or the treatment methodology I should follow. ये बहुत important है. So here what we are covering for you all is how you can create that comfort for your knees, to go for the long run. And thank you so much for wonderful, response to it. And uh, because of you only, we could able to deliver in a proper way. And because of your questions, so many people are getting their answers too. And thank you just for wonderful session. I really like today's session. And see you tomorrow, everyone. और कल का तो last day रहेगा. Any tip or any thing you want to share with our audience?
Sure. So I am giving a giveaway, free giveaway. So another exercise which you can practice for the day. So you must have noticed that we often put our weight on one leg most of the time. So let's say I'm shifting my weight to the right leg for now. So we have this unconscious habit. So what you can do is practice having a balanced posture, having a balanced weight distribution in both the knees or both the legs, like this in a straight standing position. So contrary part is shifting this to one leg. We don't have to practice this. We have to practice this one in which we are in a straight position and both feet are equally bearing the body weight. This will take practice, this will take many days, but eventually what you will see is you will decrease your knee pain. So you can practice that exercises which we did today and also this body posture exercise which will help you in long run.
या सो बॉडी अवेयरनेस बहुत इम्पोर्टेंट है. और अगर हमें स्पीड में जाना है, काम करना है, तो बैलेंसिंग इज वेरी वेरी इम्पोर्टेंट. नो सो we should practice this, and see you tomorrow then. And thank you so much everyone for joining.
Thank you everyone.
You will
Namaste.
get the recording and today's session PDF also along with the recording. Okay, bye bye, see you
See you.
tomorrow.
Namaste.
Namaste everybody.